ask questions later on, please do post in the chat as we move through session. If we don't get a chance to answer all your questions during this session, we'll collate a Q&A document to make that available afterwards for you. Before we close at 1:30, we'll take you to an interactive evaluation. Marina, our General Secretary, is going to walk us through those questions. And then we do just say, please do take away a challenge today for yourself to take forward in your own organisation. And just before I moved on, I just wanted to acknowledge that it was 75 years ago today that Empire Windrush arrived, and apparently within weeks many that were on board had actually joined the NHS. So the NHS today are thanking those individuals for their invaluable contributions that they've made to health and care. So next slide please, Sonia. So quick recap for those on the call who might not yet be familiar with NQICAN. We've got 11 regional networks. If you're not yet a member of your regional network, please do get in contact. We're going to pop a link into the chat. We can direct you to who your regional network chair is, and they'll invite you to join. We've got a common purpose and a forward plan to support all health and care organisations with local programmes for improvement, and we do hold open quarterly meetings with free to access links shared. Next meeting's next Thursday, the 29th of June at 10 AM, where we'll hear from the CQC on their new inspection framework and what this means for clinical audit. We've got a national network and sharing forum where you can join and interact with colleagues around the country. Again, Sonia's already popped this link into the chat, so please do scroll up. We'll pop it in again as we're going through session, because I appreciate the chat can move up quite quickly. More recently, we saw the launch of the National Learning and Knowledge Hub on the NHS Futures platform, focused around taking action on national clinical audit findings. We'll also pop the link into the chat for you so that you can request to join that platform if you're not already a member. As always, you can see the 4 stages of clinical audit for improvement. We always make sure we're identifying that area to improve, we're measuring, we're understanding, implementing actions for improvement, and then making sure we do evaluate that impact to make sure that we are seeing those sustained improvements. H Group have got a quality improvement magazine called Cornerstone that was launched this year, a new online free publication designed to support quality improvement in health and care. And you can access that through the Healthcare Quality Improvement Partnership website. We'll pop the link into the chat as we go through the session. So this week has been about taking out time to reflect on what we've achieved since Clinical Audit Awareness 22 and where we want to be by this time next year. So it's that opportunity to celebrate what we've achieved every day. It's not just a moment in time. It's not just about this week. It's about us all pledging to continue to achieve through year on a more continuous improvement model. So we want to share and learn together on a wider scale. So we're all going to set ourselves some objectives to take away from this week back to our own organisations, teams and patients and service users. So if we move to the next slide, just wanted to share with you some of the challenges that were set you last year from the Lunch and Learn on effectively influencing change, and we'd love to know how you've got on in your own organisations. So please do add to the chat again how you went back to check your clinical audit strategies, your clinical audit policies, your programmes, the topics, the action plans for improvement, to make sure that we were aligning it with this national drive for that continuous improvement and sustained changes. And finally, if we move to the next slide, Sonia, just before I hand over to Deb to speak with us, this is what you told us last year on the Mentimeter. We asked you in terms of clinical audit, what does utilising clinical audit to effectively influence change mean to you? And these are your words as they were on the Menti. So it was about communication, stakeholders, identifying the changes and solutions, making sure our actions were smart, real-time feedback and making the changes that are required, people understanding why we're changing and making sure that we've got clear objectives and that we can then measure that impact, utilising wider quality improvement methods to make the improvements, your stakeholders getting that buy-in at the start, and making sure it's about co-production. We're involving patients and service users to make the right change, and that's active involvement and engagement, not tokenistic. And then finally, making time for taking that action, not just about collecting the data, but actually then releasing that time to actually make those changes. So if we move to that next slide now, I'm going to very, very promptly hand over to Deborah Cundey from the Making Data Count team from NHSEngland. So over to you, Deb.
Thanks very much, Vicky. So I'm just going to share my screen separately. So just somebody give me a thumbs up or a nod or a quick yes to make sure that you can see my screen. Fabulous. Thank you very much. So thanks to Vicky and the network for inviting me to talk to you today. My name's Deborah Cundey. I'm a Senior Analyst Manager within the Making Data Count team. And I previously I joined the Making Data Count team in the summer of last year, and prior to that I was I spent 22 years of my career in mental health, learning disability provider trust, Sheffield Health and Social Care. So experience in mental health and learning disability in information and performance. I now also work as Head of Performance and Improvement in elective care at University Hospitals Leicester. So I know that you had my boss Sam Riley join you last year, so I'm not going to attempt to fill her shoes, but I will make reference to her presentation and build on it throughout the session that I've got with you today. So briefly, really briefly, before I start, for those of you who might not know, what is Making Data Count and who are we? Well, it's about using data for making better decisions. So we're a really small team, a national team, part of NHSEngland, and we currently sit within the National Intensive Support Team, and we're passionate about making the best use of data to improve services. And so some of our key functions, alongside providing intensive support to challenged trusts and systems within the recovery support programme, some of our other key functions are providing a range of teaching materials and training sessions. So many of you on the call will have come across us before and possibly done some of our training sessions. We also have a number of different tools that you can use to create your very own SPC, statistical process control charts, in a variety of different packages, from the simpler things like Excel up to things that I have absolutely no idea about, like Python and R software packages. I don't even begin to understand what they are, but that's who we are, and those are the kinds of things that we do on a daily basis. The best place to interact with the Making Data Count team and to find all our resources is on our Future NHS workspace. Details of that are on there, and I know that these slides will be shared with you afterwards, so you can go ahead and check us out and access and join that workspace if you're not already members. So all our resources, tools and training offers are kept up to date there, and you can contact us via that workspace as well. So what am I looking to cover in today's session? So firstly, just a reminder of the things that you considered with Sam last year, and then think about what we can do to ensure that the audits and improvements we make in our organisations are visible within our own organisations and beyond. So I'm going to kind of do that by telling you a bit of a story, and hopefully some of it resonates. You might have to humour me a little bit, but we'll think about what normally happens or what has happened in the past when you're doing audits, and then think about what that could look like if something was slightly different. And kind of finish off by thinking about, well, what were the key things in that story and that decision-making process that helped me in that journey, and perhaps leave you to think about how you can impact a wider audience than you currently are, if you're not already managing to make that jump to the sort of next level of where your audits influence. So hopefully that's okay for you. And we'll kick off with thinking about what Sam covered last year, was really asking you to think about the process of determining your audits, considering your key champions and stakeholders, and thinking about how you present information and get feedback. And all of those things are really important, and we'll continue to think about that today, but we'll also consider those sort of next steps and thinking about how the learning and improvements can be shared on a wider level than within the scope of the audit itself or the team within which that's taking place. So this is where I need you to use your imagination while I tell you the story, and like I said, possibly humour me. This is me, old Deb, and I work in the corporate clinical effectiveness team at St Elsewhere NHS Trust, and I've worked in that team for a couple of years and always been involved in helping determine what clinical audits were carried out each year. And if I'm honest, mostly we tended to do an audit because we'd always done that one, or we'd have to come up with a quota of audits to do in the year. And so we were, people would just rack their brains and think about actually what should we do an audit on, or carry out an audit because a consultant or a nurse had got a specific interest in a particular topic. And that's exactly what happened in my story in 2019. Dr. Smith, who was working in A&E, mentioned something about whether or not mental health triage assessments were carried out when patients presented in the emergency department at St Elsewhere. So I thought that was interesting, and I set about finding some data from our ED electronic system and checking notes, medical records. So I looked at data from a random selection of dates across a 4-month period in the summer of 2019, and then I produced a report that I was really pleased with. So I think I did a really great job, and I gave Dr. Smith a brilliant report. Look, it was a comprehensive Word document, and I went into detail about how I'd done the audit and showed the results for each date that I audited the patients in a bar chart. And so I was really pleased with that, and particularly pleased because of the sample that I did the audit on those dates. Actually, I found that mental health triage was carried out 80% of the time, and it turns out that was the target. So so that was really good. And I know that Dr. Smith took my report to his monthly care group governance meeting, but I think they ran out of time to talk about it on the agenda. So I don't think that actually anything happened with it beyond him taking it to that meeting. So I think I was a little bit disappointed, if I'm honest, because I'd worked really hard on that audit. As I was leaving work that day, remember we're in pre-COVID 2019, when that was still what we did, went to work in various places and sometimes left buildings. So I bumped into Vicky in the car park, and we got chatting, and I mentioned that I was frustrated by the fact that I'd done this piece of work, that I thought it showed something good, or at least it was interesting, but that it probably wouldn't ever be recognised anywhere. So Vicky said she'd have a look at my report. She was very kind, and so I emailed it across to her, and when she'd had a look, she suggested that I get involved with the NQICAN network and have a look at making data count training, so then I could pick up some tips. So that is what I went away and did. And I never looked back. So I picked up loads of tips from the NQICAN network, connected with lots of peers and colleagues that I hadn't done before. I completed all the step training that Making Data Count team put on. And that was really easy to join team sessions or watch recordings. So I had a much better idea of how I could present the information and be really engaging. So then I thought that actually I could possibly make a real difference in this area. So I did some reading, realised that completing mental health triage in A&E and emergency departments is a priority for acute trusts and can have a really positive impact for patients and staff. So I had another conversation with Dr. Smith, and together we approached the chief nurse with the suggestion that we do a more robust audit in that year, and she agreed. So at this point, these were the things that I knew I had in place in 2022. I'd got an agreed organisational priority that we were going to undertake an audit and an improvement plan on. I'd got that executive sponsorship and investment in the audit. I don't mean financial investment, I mean investment engagement with the topic being important. We'd got a robust plan for the audit and the improvement plan work, and that we'd worked up together collaboratively with Dr. Smith in that wider emergency department MDT. And together in that team, we agreed what our key audit questions were going to be. We negotiated that this would be a weekly audit, that we would continue to collect the data on a weekly basis consistently, and I was able to get baseline data to understand our starting position. Together, we developed and tweaked our improvement plans. We were clear about who would take actions and who had responsibility for what. We put in time for frequent, regular touch bases to review the data, see what was working, what wasn't. And finally, importantly, we agreed those timescales that we would feed back to the chief nurse with the outcomes of our audit. Oh, I've moved on far too quickly, haven't I? So we then set to work. Well, I say set to work, actually, the team set to work and I basically plotted the dots. So using tools that we have available in the Making Data Count resources, I plotted that information. So we could see from our baseline data, we could see that the process of completing mental health triage assessment in ED was quite variable. We'd never actually hit that 80% target, although we can see from those process lines it was statistically possible, but our average performance back at the beginning of 2019 was well below that 80% target. So we agreed an improvement idea within the team and we continued to plot those dots. And then we could see that improvement, especially that initial improvement and the improved average rates. And sometimes we even achieved the target in a particular week. So we can see that that improvement idea had kind of narrowed those process lines. So we celebrated that achievement and we refocused on improving again and continue to put those dots. So then again here you can see we've managed to improve again, and our process limits then showed us that we can expect to achieve anywhere between 70 and 98%, so much better than we were doing previously. So again, keeping on plotting those dots on a weekly basis and looking at that information regularly in the MDT, celebrating those little wins and those achievements. And then finally, when we've got a real good range of data and we've implemented our 2 improvement ideas, then we can begin to see that real sustained improvement. We've recalculated again, and that's where we were able to have our real party, because we can see that the improvements that we made and sustained have resulted in these process limits moving above our 80% target line, which means that we were consistently hitting the target. Our variation icon shows us that we've got common cause variation in our process, and our little blue icon tells us that we're going to consistently hit that target. So we've now got a stable, capable process of completing mental health triage in ED. So all the hard work was essentially done by the team with their putting into place the improvement plans, the actions that they take. And my focus then as the clinical effectiveness kind of administrator was about preparing a simple, concise report that could demonstrate the original issue and the project, trying to think about what the original issue was, what our plan was, then providing the results of that audit and the improvement plan, sharing that visual to help people see the real and sustained change that the team had made, and really importantly demonstrating the impact that was having on staff and patients, and then what we would do about that next. So the next thing in the kind of process was making sure that that report, that write-up, that poster, that slide, whatever format I chose to do it in concisely, was shared in internal governance structures with managers, clinical leaders within teams and care groups, etc., so that they in turn understood it and they were able to explain that those improvements to at a more senior level at trust board or committee level. And of course, we'd kept our exec sponsor, the chief nurse, informed throughout the programme, so they were also aware. And I think that's then key in being able to think about how you take that learning and share it wider beyond the organisation that you work in. So, as you know, you, your colleagues, senior or otherwise, will all have different connections and networks. I think the best thing to do is just to make use of them. You've got those few examples that have popped up on your screen now. We've got regional networks. You've obviously got your NQICAN networks, professional networks. People put things forward for awards and nominations, and of course we've got a really well connected Making Data Count workspace, and lots of communication goes on there, so it's a great way to share your work. So just as I kind of wrap up and finish off, just really want to think about what was the difference between old Deb and new Deb. So Deb in 2019, Deb in 2022. What things were the most important things that made a difference to how the work was carried out and presented, and how we were able to share learning wider in 2022. So I think firstly, having that champion for whom this was really important. So understanding it was a priority in the organisation, but that executive sponsorship, the chief nurse being interested in it, was really, really key. Very importantly, understanding what our baseline position was, really understanding what the position was of the ED department at the beginning of the improvement plan, and that consistent, timely monitoring of the information, keeping on plotting those dots. The fact that I worked with the ED team early on, engaged them early on, and maintained that engagement, allowed them, or not even allowed them, basically insisted that they own the issue and they own those kind of improvement ideas. And I was just supporting them by giving them access to the data, showing actually how they were getting on, so that they were able to kind of follow those PDSA cycles. Really, really importantly, I think, Vicky, you touched on it in your slides earlier, allowing that celebration, celebrate those achievements, no matter how small they are, because they can lead to bigger things. Also, once you celebrate achievements, no matter how small, it also, I think, makes it easier to not be afraid to say when something's not working. So focus on the things that are having the impact, the improvement impact. And then finally, keeping that presentation of audit findings concise and simple, and essentially outcome focused. I know it's really tempting to write really long reports, especially when you've been heavily involved in something, but the more concise and the easier it is for people to consume, the more engagement you will get, especially beyond your team. But remember, this is just a kind of a story made up, really, but loosely based on past experiences and the art of the possible. So I might have hammed it up a little bit just to prove the points. But I guess my sort of takeaway message for you today is, if you aren't already doing some of those things when you're thinking about your audits and carrying out your audits and your improvement projects, I hope it's made you think about how you could put some of that into practice in your current roles and organisations. So I'm going to stop sharing my screen now. I'll hand back over to Sonia and to Vicky, and we'll get to the important business of celebrating the achievements of your heroes today.
Lovely, thanks, Deb. We'll just let Sonia share the screen again and get the next slides up. It was really informative, as always, and making us all feel motivated from the Making Data Count team again.
Thank you.
Fantastic. We'll hand back to you, Deb.
Right, just give me 1 second while I make sure I've got the right things on my screen. So, the more important reason that I'm here today, thank you for being so kind, Vicky, and saying that my presentation was informative. Like I say, I do hope it was, and please do connect with us in the Futures Workspace. But the more important topic today, I've got the privilege of announcing your Clinical Audit Hero winners. And before we move on to the winners, the first mention goes to a team who've been highly commended by the judging panel, and I'm very pleased to announce that that highly commended award goes to Next slide, Sonia. It goes to the Dementia and Delirium team at Southport and Ormskirk NHS Trust. So I'll just say a little bit briefly about the team. So really well done. Thanks for the applause, everyone. That's fabulous. Just to say that the judges were really pleased to commend the team for a re-audit against the 2019 SIGN 157 guideline, which is risk reduction and management and delirium, and the 2019 NICE CG 103 guideline, delirium prevention, diagnosis and management. And the particular, what was particularly pleasing for the judges was an innovative Keep Me Here initiative, which was created to prevent inappropriate hospital bed moves of patients with complex symptoms of dementia and slow to resolve delirium. And the initiative included an electronic form on the clinical system to indicate that a patient should not be moved. So a really, really well done to all the team at Southport and Ormskirk. And you've already done your virtual applause, but a massive well done from me. So this year, the judging panel couldn't choose a definitive winner either. So there are 2 joint winners, and I'm really pleased to announce that the first joint winner of the Clinical Audit Hero Award goes to Amy Baker, who is Patient Outcomes Manager and the Patient Outcomes team at Cambridge University Hospitals. And so we've got Amy and the other joint winner presenting their work today, so I won't steal their thunder, but just briefly, the team at Cambridge was recognised for designing and populating a national clinical audit benchmarking database, and particularly the judges were impressed by how the project encouraged the engagement of the audit community and focusing on the improvement of care and treatment for the benefit of patients, and particularly again noted how centralising the results had improved clinicians' access to results, which freed up time to care and improving transparency across specialties. So fabulous, well done Amy and the team. And then finally, the second joint winner of the Clinical Audit Hero Award goes to Ella Bowden-Howard, Emotional Health and Wellbeing Service Assistant at Cambridgeshire Community Services. And Ella was recognised for taking a different approach to her audit programme using her psychology background, and she understood that just producing a reliable tool wasn't enough, and she focused on what could prevent clinicians producing quality documentation in order to determine what gold standard looked like. And judges were impressed by how Ella had introduced a regular review process that required leads to look at how effective their actions have been in practice and agree focus for the next quarter using emerging themes, and then also remarked that she transitioned her audit programme from being a standalone tool into a QI project and created a positive audit culture where supportive peer review took place. So again, really, really well done to Amy and Ella and their teams. And I think I'm handing over right now to Amy so that she can share more.
Hello everybody, good afternoon. My name's Amy Baker. I'm the Patient Outcomes Manager here at Cambridge University Hospitals, so it's nice to see everybody today. On behalf of the team, I just want to say a huge thank you very much. This is really exciting for us after a lot of blood, sweat and tears to put this together, so we're very happy to celebrate and showcase this today. So just in case anybody wants to know as well, I will also be doing a more in-depth review of this, like a case study with our colleagues at Future NHS on the 19th of July. So please keep an eye out for that Taking Action link, and I will be talking in more detail about this then. Okay, next slide, please. Fantastic. So for anybody who's wondering, what is this National Clinical Audit Benchmarking Database? I'm sure those of us in the community have already heard this National Clinical Audit Benchmarking with our colleagues at HQIP and that sort of thing. Basically, we've wanted to sort of take a concept of that, but develop it further based on some criteria that we had here at CUH. So what some of the things we've got is basically we wanted to be looking at the details provided by HQIP, but more in depth and also more with our colleagues in mind, as in our clinicians in the trust and what they were sort of looking at themselves and how we could pull this together. We've been doing this as a trend analysis piece of document, as you'll see as we go along. So you'll see we also have incorporate several years of data. So this has been very exciting. It's taken several years to build. Next slide, please. So as you can see, these were some of the main concepts that we wanted to come in with the sort of implementation. So I won't go into the drill downs, but I'll just cover the sort of 3 main things that we were trying to pull together when we developed this. So one was a centralised access to results. So basically, it was open, available to everybody, and everybody could get it in one place. Standardized reports. We all know different reports look different from different audits and registries, etc. So we wanted something that would just be a visual concept that was just across the board the same for everybody, so that anybody looking from any area would be able to see that data. And then the other one was self-service dashboards. So what we mean by that was our clinicians and our other teams could access that data at any time they liked, you know, whether you're on a night shift or a day shift, and whatever you want to do, you can look at that data yourself, so you can filter it down. Next slide, please. Thank you. So these are just some, oh, if you wouldn't mind going back one, sorry. Thank you. So these are some of the changes that we've noticed since we've implemented this. So I'll go on to the build shortly on the next slides and after, but the actual implementation of this since we've brought it in over the last sort of 18 months has been huge. We've found that discussions are taking place at any level in the organisation. And by this, I mean, you know, whether it's a local auditor compared right to the top of the board. We've also found that discussions have changed. So we're not just looking, you know, very basically at the results going, are we doing worse? Are we doing better? It's created a real shared concept of, well, how is this impacting our patient outcomes? And what are we learning here? And also as well, with the pandemic recently, we've been seeing what impact the pandemic's had on our results to these, which has been really interesting. It's also avoided senior clinician review. We put here, which does not add value. What we mean by that is saving their time to come to, say, a meeting and discuss this. When we've looked at the results in full, we can see the trends, we discuss it, and then they can perhaps just provide some commentary out of governance meetings to say, well, yes, this is because, you know, XYZ, maybe we need a new piece of machinery, maybe we need a new whole-time equivalent nurse to support this team. It's really fostered a really encouraging trend of just what do we want to do better and how do we want to do it, which is really fantastic. It's really increased that collaboration. And as I put here as well, some competition. I'm sure we're all aware it's quite good fun, obviously, like just to create that community where people are kind of interested in what each other are doing. So that's been very good, and people have actually really enjoyed that observation. As I said before, the live data has been used at our governance meetings. This has also been fantastic for those sort of instantaneous answers to questions and answers. As you all know, when people want to drill down to the data, it's fantastic just to be able to provide it there and then, you know, rather than being able to take it away and then try and put together all the answers. It's certainly made everything a lot clearer in terms of those sort of things. And again, it's just allowed a lot more celebration of results. That I think has been one of the biggest things. You know, we're really celebrating the care that our patients are getting, and I don't think, you know, we can do better than that. It's really nice to see where we're doing things well and where we're making improvements and how that's all coming together. Next slide, please. So how our data is accessed on our database. So we have 4 levels that we provide here. You can see the 4 in blue and 1 in green. So the 1 in green is our master data. So everything in this build is built on Excel, and it basically syncs from the master data, which gives the clinicians an area that basically they can drill down for the extremely detailed level of data. But what we have is we've basically built 4 dashboards. Now, these are individual dashboards at 4 different levels here that provide the right person in the trust with the right information they need. So it really filters people to what they need, such as organisational level. So this is like really high level board information about how we're doing year on year. Divisional, here at CUH, our specialty teams break down into divisions and directorates, so they can see that really, really clear and basically see that information as they go along, and they can even click on their own directorates. So for instance, if we've got in Division A, MSK and ICU peri-ops, and they want to look at both of them, but maybe not digestive diseases, they can do that. Annual reporting is basically our yearly reported and published clinical audits. So that just gives us yearly trends on how we're doing. And then the monthly reporting is for projects such as proms, etc., where we're having those monthly data come out. So everybody can then see how we're doing over the course of a year, and thus also year on year on year. So it's whatever they'd like to filter to. Next slide, please. As I said earlier with the self-serving dashboards, we have basically built in these filters within the data. So it really has made it clear for clinicians. As you can see here on the images on the left and the right, this is an example of what happens when people click down on the filters. So what it does is it hides information that they don't need as well. So there's no chances of misclicks or errors or anything like that. It will literally show the clinicians all the information that they have available at that time and how many years worth of data that they have. It really provides a true clarity of what their trends are and what is currently going on with their information. It really helps as well when audits may be published biannually, or again, as we're all aware, some of the catch up that's happened with the pandemic. It's really helped with clinicians to see currently what's going on and what's behind in publications, etc., etc. Next slide, please. So we then does the viewing data. So what happens is when people click on those filters, we have a range here, as you can see, of graphs. And what happens is each one changes live as each one is clicked. So this allows us to use quantitative and qualitative data. We also have clear progress viewable. It links to the CQC as well. We have our CQC Chloe domains captured here too, so people can see what's going on, as well as our outlier data. But all our data as well is filtered so that people can see our compliance with CUH, the national standard, see whether we're benchmarking that, but also we benchmark against our peers. So it provides a really good, interesting concept because, you know, there may be times we may be better than our peers, but not in the national standard, or worse than our peers. And then that creates even more discussions with peers at these other sites to say, well, what are you doing differently to us? Is it, say, a different scale in hospital size, or is there a really interesting treatment going on that perhaps we haven't got our hands on yet? So it's really creating a whole load of collaboration. Next slide, please. So this is just basically an over concept. This is what it looks like when people are actually using it. Obviously, as you saw before, there's more graphs. They can just filter across, and literally they can just use the left-hand side. None of it is coding. It's tried to be made as simple as possible so that the clinicians can just go in and use it as they like. They can select their dashboard on the left, select their filters, and then everything changes 24/7 as they need it. So it really has just become a big coalition of data, and people are really accessing and using this. Next slide, please. So that's a kind of coverage. Again, I will be talking more about this case study on the 19th of July, but I would like to take any time for any questions if anybody has any questions on this information that I'm presenting today.
Thanks, Amy. That was amazing. It was really good and really useful. I'm sure again have lots of people contacting you after this. So has anybody got any questions for Amy before we move on to our next presentation? Do you want to raise your hands if you've got any questions? I have got one. Oh no, let's go to Zoe first. I'll keep mine as a backup for you, Amy. Zoe, do you want to ask your question?
Yeah, thanks, Amy. That was really interesting. I suppose I've got lots of questions, but I'll just start with the obvious one. It's like, so how do you get all your information into your database from your national audits? Do you have to sort of like do you take that from your reports? Does somebody put it in? Does it automatically get pulled through?
What we have is basically, because this is Excel, we've built that master database sheet, the one that feeds into the other dashboard. So what happens is we just look at the publications, so the actual data that's coming out. Takes us maybe about 5 to 10 minutes to transfer the data across. We put it into the master database, and everything automatically republishes itself into the dashboard. So it's pretty much instantaneous. The document thinks for itself in that regard. So it is a really quick system, and we've found it really just makes the viewing a lot easier of those publications, and also that sharing of the governance and then what action we want to take. So it has been really beneficial and quick, which is what we wanted to make it, which is good.
So it's just the time that you have to take to populate the...
Absolutely trim the time down, which is fantastic.
So right. Oh, thank you.
No problem.
Amy, who set it up for you? Was it your audit team, or did you have some more help within the organisation?
No, our team are fantastic little Excel whizzes. We've all put our heads together. We've done a very similar amount of work with our NICE databases as well. I couldn't be prouder of our teams. We're just all very prominent on Excel, and yeah, we've just put it together with a lot of blood, sweat and tears, as it were, and I couldn't be prouder, to be honest. It's a fantastic piece of work, and it's really making a difference in the organisation.
That's brilliant. Lovely, thank you.
No problem.
If we don't have any more questions at this stage, then shall we move on to our next presentation? Lovely, thank you.
Hi everyone, good afternoon. Thank you for having me. So my name's Ella Howard, and I am the Assistant Psychologist with the Emotional Health and Wellbeing Service that sits in Cambridgeshire Community Trust. So we are a community-based trust, and our team within the trust is a skill mix team that supports primary and secondary age individuals experiencing low to moderate mental health difficulties. And so our audit was on looking specifically at our clinical record keeping as part of quality assurance for our trust, and we took a different approach looking at the people side of change, so thinking about audits as a continually evolving process, engaging staff in peer-to-peer learning, not just one-off data collection, increasing our auditing cycle to 3 times a year to help identify strengths but also areas for improvement around record keeping. So the work that we've done was across December to March, and we've got our next one coming up in July, but we found from December to March that we had a 7% increase in quality of record keeping just from those 3 months, with the main impact from our audits being improved patient experience, minimising risk and safeguarding through accurate and chronological recording of clients' healthcare journeys, helping staff to work more efficiently and increasing accountability and confidence of our practitioners. Next slide, please. So on the left, so I know there's a lot of data there, but on the left is a summary of our audit results from December and March against our set of record keeping standards. Now we have 12 that are the trust standards, but we also have 12 that are very specific to our service, to what we want to look at specifically to do with our record keeping. So I just wanted to pick out a few really big increases that we saw there, and improvements, which was specifically around recording groups and relationships, making sure that our notes and were on our systems for within 24 hours. That was a 20% increase, and then we had a 33% increase in stating who attended the sessions, and overall we found quite a lot of improvement across all of our standards just from that 3 months. And as you can see on the right hand side there at the top, were our top 5 areas for improvement that we really wanted to focus on. So we made sure that we celebrated those wins, so those big increases that we saw, but we also wanted to allow time for improvement, and really specific improvement as well. So we're not overloading people with all different areas that they might need to focus on. And so we really, in between our audits, we really focus on those top 5 areas that we've noticed. And even with those top 5 areas, as you can see for the top 2 there, we still had improvement. Next slide, please. So when we were thinking about our approach to auditing, I really was focused on making action plans and really thinking about a quality improvement approach that we've got within our service. And this sits within deep dive, which is really getting in that information from the audit, design, so looking at the tools that we've got, what we can put in place to support our practitioners, delivering those tools, but also having it as an evolving approach so that it's not stuck in stone. We're constantly getting those information in from our staff and making sure that we're listening to what they need so that we can put that in place to support them. And so it was important to recognise with audits and with change specifically that some people might be reluctant or cautious, as you can see at the bottom there of the adoption curve, that we were really, when we were looking at kind of change models and how we can get people involved, we were really looking at that psychological aspect of change. So we recognised that people might be reluctant or cautious to change, and the audits may bring a sense of confusion and kind of disruption to practices. And I always like to think on the top one there of the change curve, that little circle in the middle of stages 2 and 3 is where the audit sits. So we're sitting there and where we're disrupting a little bit, but we want to make sure that we're coming out the back end towards exploration and commitment towards change. And that's all about getting everyone on board and focus on that main goal of improving our record keeping so that we're improving our clients' experience with our service. So when we were looking at how we can get everyone on board, we're really thinking about unlearning old habits and adopting best recording practice. So that really fed into our action plans that you can see there and you can read through. I won't go through all of them, even though I could, and I would love talking about it, but you can see some ideas that we came up with that were really effective within our teams. And so when we were preparing in between our audits and when we got the audit results and we were preparing for the next audit and the learning in between, we were finding the gaps, so looking at who was missing from conversations, what was the type of learning that was missing, that would really help the team be cohesive in change. We were offering Q&A sessions and frequently asked question documents around record keeping. And also I created an audit guide. So this really helped the team understand what the audits were about, what each of the standards meant, what we were looking for. So it wasn't just we were doing the audit to them, we were really involving them in that process. And this really helped when it came to peer-to-peer auditing too, because they would take the audit guide and be able to work through that, so that when they gave the results back to me, I'd be able to look over those results to make sure that we were sustaining inter-rater reliability, but also that they were learning and we were educating them around record keeping and auditing. And so we weren't just showing, we were demonstrating and supporting that change from an individual practitioner level. We were also looking at how we feed back to our practitioners and preparing staff for the next audit. So we were having one-to-one meetings with leads, as well as having team meetings. And we were wanting to deepen that knowledge beyond just the audit guide that did have a quite comprehensive explanation, but we wanted to allow practitioners to be able to come to us, to be able to talk through things that maybe they were unsure about, to get that real clear understanding. And so we were also thinking about learning from previous audits. So we were identifying the need for that action plan and looking at or re-evaluating the different approaches that we had the first time. So it was ever evolving. So we do the audit once and then we review it, we see what we need to change and evolve to make even better for the next time around. And from the December audit, we really tested out the peer-to-peer auditing approach, which really was effective among our teams. And you'll see just in a moment some feedback that we got. So next slide, please. So this was also something new that I created within our service. So I wanted our approach to be inclusive and to hear everyone's voice and understand practitioners' needs around record keeping. And we wanted this to be for all staff, so those who had done an audit before and those who hadn't. So this was a survey that we put out and we got about a 31% response rate. And we looked at areas around feelings towards record keeping and training, their engagement with established resources we already had, and their understanding of record keeping difficulties, and how we can support everyone to overcome any barriers that were identified. And these results, especially for the bottom right there, so the areas that they really wanted support with, really fed into our action plans. Next slide, please. Oh, there we go. So this was also something that I created within our service that we're really super proud of, and something that's ever evolving. And we were really conscious about wanting to future-proof auditing and the understanding around auditing and create a sustainability around our auditing approach. So I created our audit champions networks that you can see there on the screen. We sent out a proposal to the service which gained a lot of support from our team leads and requested voluntary recruitment with the aim of developing an ever-evolving network of individuals who are passionate about record keeping and quality improvement. And as you can see just on the right-hand side, we have got at least one person covering each team, and we're just waiting for the last one to come. But we've got more or less full coverage across our service. And I anticipate the difference this will bring to clients and staff will be the continual reinforcement of record keeping standards, improving the quality of clinical notes, and offering this golden thread of record keeping knowledge and excellence throughout the service across all job roles and teams. So everyone really has access to people that are being trained up around auditing and record keeping. So we're spreading that knowledge far and wide. Next slide, please. So here is a bit of unsolicited qualitative feedback that we gained from the record keeping survey that we sent out about how people felt about our peer-to-peer audit model and our approach. And it really highlighted how people found it really useful in terms of building their confidence, identifying areas that they felt that they needed to improve on, so they were able to see it themselves and not just be told, so they were able to learn it from a first-hand point of view. They really appreciated how supportive it was in terms of they weren't being told off, they were being brought along in terms of supporting them around change and them understanding how vital it is to make sure our record keeping is at that high standard. And so overall, the numbers that we got from our audit were valuable for an oversight of what the big picture is in terms of where our service sits in meeting the standards around record keeping, but to make quality improvements and minimise variation in interpretation of what good record keeping is, my focus was on collective progress towards sustaining and being increasingly more compliant against record keeping standards that we were measuring in the audit. And one of the main key factors that we found was that time was a key factor that came up as a barrier to good record keeping. So we will be focusing on selling the vision of how we can streamline and make record keeping more efficient, to save time for excellent planning and analysis to support improving health outcomes and client experience. So we're really key on getting that information from our practitioners in order to feed into our action plans and how we can best support them to even improve even further our scores for the next audit round. Next slide, please. So I just wanted to say thank you for your time and for listening and for the recognition from this award. We're really happy to have our work recognised as trust. And I guess my takeaway message in terms of thinking about change and really thinking about the people that are within your teams is to celebrate those wins. That not everything is going to be huge wins. It might be incremental change that you see, but to get everyone on board with seeing how even with that incremental change, it can have such a huge impact from your clients or patients to staff level, to service, and even to trust wide. Thank you, everyone. And if you've got any questions, here's the time to ask.
Thank you, Ella. So I can see we've got people with their hand up. So Elaine, we'll go to you first, please.
Sorry, I don't know if you can tell me. I was actually, but sorry, I was very impressed.
Thank you.
Okay. Have we got any more questions then for Ella? You know, now you've got your audit champions in your area, Ella. I'm just thinking, just listening to Deb obviously talk to us about plotting our data over time. Do you think there, with record keeping audit, there's the ability to start to continuously measure and be plotting those dots against the audit standards? Do you think that might be a possibility?
Yep, so we're at this time around, so the July one that's coming up, our service has kind of reevaluated our tools. So as everyone's kind of been saying, it's really important to make sure that your tools are matching what you want as a service or as your teams. So we have reevaluated and we've kind of streamlined our audit standards. So we'll be kind of starting a little bit from fresh. We've still got the same ones we had before, but a few different ones. So again, from that point on, we will start comparing. We'll be able to plot from there. And I was really impressed by seeing all of those graphs. It looked really nice, so well done.
Oh, that'd be fantastic. It'd be great if once you start plotting those dots, if you're able to share that on our forums and things, because I think it gives people that confidence to start applying that more to our local audits. So it'd be really good to see.
Yeah, no, of course.
Lovely, thank you. Have we got any more questions for Ella? Oh, Heather, would you like to ask yours?
Yeah, many congratulations, Ella. We're all super proud of you. You've made a real change in culture and for record keeping. Just how did you find the peer reviewing was received? How did that work as a concept?
It worked really well. It was slow when we put it on, so we piloted it the first time round. So we did it with one team within our service. We found out how that went. We sorted out in terms of what we needed for the audit guide to re-review that and make sure that everyone was understanding the standards correctly. But everyone kind of took it on board and realised that it was a learning opportunity. That's really how we've been selling audits across the team, and having that effective change that we've seen is the fact that everyone's now coming on board with the fact that it's learning. It's not there as anything that's punitive. We're auditing the process, not the people, and so people have been really on board. And I've got all these leads, got all these so many ideas that they keep trying to bring my way, which we're going to try out. And so there's different ways that we'll be think of improving the peer audit process going forward too.
Lovely, thank you. And finally, we've got a couple of minutes. Has anybody got any questions they want to put to Deb and the Making Data Count team whilst we've got you on the call? Elke?
Yes, thank you. One of the things, so I'm always very impressed with these SPC charts, and I have absolutely no idea how one would create one. Is there an easy way of making that happen?
Absolutely. So I mentioned our future NHS workspace, and we have, sorry, can you hear me? Sorry, I've just realised I had my mic up. Absolutely, Elka. On our future NHS workspace, Making Data Count workspace, we have links to tools that have been created by the team that you can use. So again, varying from simple tools in Excel that anybody can use because you've got access to Excel in your organisations, to those really complex things that you might need support from your BI and information teams to produce. But yes, we've got those tools that you can use simply. So we've got a single SPC chart, then we have things like multi-tools that allow you to create 25 in one space, and we also have some different kind of statistical charts, Pareto charts, and other charts that, again, I don't necessarily understand, but all the hard work is done for you. I'll pop the link to our Futures workspace in the chat as well, and if you're not already a member, you can easily join.
Thank you.
No probs.
Brilliant. Thanks, Elka. Thanks, Deb. Okay, I think if we just move on to the next slide, Sonia, we're going to promptly hand over to Marina in a minute to run our interactive evaluation, but we've just included a slide here again, just to challenge you again to go away and start thinking about how your strategies and your projects and your programmes align with really effectively influencing that change at an organisational level. So the slide will be there in a slide pack, because I appreciate we're literally passing through this slide, but if we move to the next one, I'll hand over to you, Marina, to run our Menti for today, if that's okay.
Thanks, Vicky. Yeah, so as I mentioned in the chat earlier, as we have done all week, we're using Menti to be able to do our interactive evaluation today. So all you need to do is go to menti.com and enter the code, which will be on the screen in just a second. Or there is an option of using the QR code if you've got something like your phone with the camera option on it. So hopefully that is sharing. Might just take a second. I know sometimes they do. Give us a thumbs up if that's sharing, everybody. Yeah, fantastic. Okay, so so menti.com, and you can either type in the code 56294065, and that will take you to our evaluation for today. Or you can use the QR code that's on screen. I can see people joining us now. That's fantastic. We'll just give it a second and then we'll move the slide on. You can answer the first question. This is only very short evaluations. We're keeping them very short and tight this year, rather than trying to send out survey forms afterwards. Okay, so we'll make a start. Okay, so you can see on here we've got the sliding scales, as we have done for other presentations earlier in the week. So in terms of whether the key speaker presentation has been interesting and engaging, it's had the right level of information, and you've learned something that you can use in your work. And then the same questions again for our award winners presentations today as well. And then finally, in terms of whether you would recommend these lunch and learn sessions to others. Oh, I can see people starting answering them now. Fantastic. Super, just give everyone a chance. Really positive responses. Thank you ever so much, everybody. No, I've certainly enjoyed today's session as well. Really interesting speakers. Thank you. Right, and then we'll just move on to the next. Oh, a couple more coming in. I don't want to rush anybody. I'm just conscious of you all getting away on time as well. So it's just that sliding scale on the menti.com. So the code still is at the top of the screen there if you still need it. Brilliant. Thank you very much. Right, okay, and then we will move on to our next one. Oh, one more jumping in then. We'll move on to our next one then as well. So but the next question then is, in terms of what is your top takeaway from today's session? What is really that thing that's really resonated with you, that's going to be your takeaway from today's session? And you can pop that in just as a sort of short response. Start typing them in. Fantastic, they're starting to come through now. That's brilliant. Some great answers coming through. Yeah, Excel Excel tools, so much more that we can do with it. I'm not an Excel wizard, and yeah, it really does make you think, doesn't it, the options that are there. Auditing the process, not the people. Interesting. Okay, we'll just give it a minute for the responses to come in, and then we'll move the slide on to the final question for today's evaluation. Yeah, the links to the Futures platform. And then the final question for today's evaluation then, is there any additional feedback you'd like to give us about today's session that we can take away and learn? Because, you know, we're all about ongoing learning. It's what we all live and breathe, is ongoing learning. So if there is any learning from today's session that you'd like to give us for future, then that would be absolutely fantastic. Yeah, the issue is when people are joining the wrong link. I really don't know what happened there, but we was definitely learning that we will try and take away, and we will try and ensure you know, is resolved for any future sessions. Is any other additional feedback, Vicky? So I'll stop sharing and hand over to yourself then, just for the final word on things.
Oh, lovely. Thank you. I just want to say really, really big thanks to Deb for coming from the Making Data Count team, and please do go visit their site on NHS Futures for all the training packages. They're absolutely invaluable. And thank you to all our lovely winners and our highly commended as well. And it's fantastic to see your projects presented. Please do, if you can, join us tomorrow. Last day of Clinical Audit Awareness Week. It's all about sustainability, and we've got John Ashcroft coming from, who is the Director of Pathways at NHSEngland, to talk to us, and it will be touching on the NHS impact. And hopefully some of you are joining us later on this afternoon, 3 till 4, for the NHSEngland event as well, from Vin Dowaker and Michael Sykes. Thank you so much for joining us. Recording and slide packs will be made available as soon as possible for you, so that you can access those and share them widely. Have a fantastic afternoon, and hopefully we'll see many of you again tomorrow. So thanks for joining us.
Thank you very much. Lovely to see people.